Have you ever felt dizzied or confused or just off and wondered, what on earth is my brain trying to tell me? Well, it turns out your nervous system has its own secret language, a whole series of signals and reflexes that doctors can actually read to check its health. So let's dive right in and decode the neurological exam.
You know, it usually starts with a feeling we've all had at some point. That weird, dizzying, disorienting sensation where the world just feels a little wobbly. But these aren't just random feelings. Nope, they're actually the very first clues in a fascinating medical mystery, an investigation into the most complex object we know of, your brain.
And these feelings are part of a whole vocabulary of distress signals. Think of things like sudden pain or muscle weakness or weird sensations. It's like your nervous system is sending out an SOS, a signal that something, somewhere, needs a much closer look.
And we can start decoding these signals right now. Take dizziness and vertigo. We tend to use those words interchangeably, right? But in neurology, they mean two totally different things. Dizziness is that general, kind of lightheaded, off-balance feeling. But vertigo? Oh, that's the very specific, unmistakable illusion that you or the room itself is literally spinning. Getting that distinction right is a crucial first clue for any doctor.
So with all these clues popping up, how does a doctor actually solve the mystery? Well, they pull out their toolkit. And that toolkit is the neurological exam. It's this really systematic investigation designed to test every single major pathway of your nervous system. And this whole investigation follows a really clear roadmap, broken down into these 6 key areas. We're going to follow that exact same map, starting right at the top with the brain's command center, and then we'll work our way down through all the body's complex wiring.
First things first, the detective needs to know if anyone's home, so they start by assessing cerebral function. We're talking the high-level stuff: consciousness, thought, memory. It's basically like checking the central processor of a supercomputer to make sure it's running correctly.
So, here's a question for you. What do you think is the very first domino to fall when something starts going wrong neurologically? You might think it's something dramatic, like a seizure or paralysis, but actually, the earliest and most critical warning sign is a change in a person's level of consciousness, just a subtle shift in their awareness. But hold on. Consciousness can feel pretty subjective, right? So how do doctors all over the world measure it in a way that's consistent and objective? Well, they use a standardized tool that turns simple observations into cold, hard data.
It's called the Glasgow Coma Scale, or GCS, and it scores a person on these 3 key responses. Eye-opening checks the brainstem's arousal circuits, that's the basic on switch. Verbal response tests complex stuff like memory and language. And the motor response, that shows if the brain can process a command and tell the body what to do. A fully alert person scores a perfect 15. Someone in a deep coma scores a 3.
And this is where the power of the scale really hits home. A number tells a whole story. And a score of 7 or less, well, that's a critical alert. It signals severe damage and a potential neurological crisis. It's just a simple number, but it has life or death implications.
Of course, the command center is way more than just an on-off switch. The exam also probes deeper, checking all the other circuits. They'll test memory. Can you remember these 3 words I just said? Language, and even abstract reasoning, asking something like, how is a lie different from a mistake?
Okay, command center is checked. Now it's time to check the wiring. This means diving into the motor and sensory systems, and, my personal favorite, those fascinating automatic reflexes that happen without you even thinking about them. So to test the motor pathways, a doctor will have you do things like push and pull against their resistance. Don't let me push your arm down. Your strength then gets graded on this really simple 0 to 5 scale. 5 is full power, 0 is complete paralysis. And this little stick figure you see here, it's a brilliant shorthand for doctors to quickly map out a patient's strength across their entire body. Next up, we have to check if signals are getting to the brain. For this, you close your eyes. The doctor then tests your sensory pathways. Can you feel the light touch of a cotton wisp on your arm? Can you tell the difference between something sharp and something dull? It seems simple, but it can reveal if a nerve pathway is damaged anywhere from your skin all the way up to your brain. All right, let's move on from the signals you consciously feel to the ones that are totally automatic. We've all had this done, right? The doctor takes out that little rubber hammer and gives your knee a tap. What in the world are they actually learning from that little kick?
That knee jerk is a deep tendon reflex, and it's an absolutely incredible diagnostic tool. In a split second, it tests the entire nerve circuit, from the sensory nerve to the spinal cord and right back out the motor nerve. Get this, that signal travels at over 250 miles an hour. The response is then graded on a scale where 2+ is perfectly normal, but if it's absent or way too hyperactive, that gives the doctor another vital clue.
And now for one of the most famous tests in all of neurology. A test that uses a simple stroke on the bottom of your foot to check for major problems in the brain or spinal cord. Okay, here's the deal. When the sole of an adult's foot is stroked, the toes should curl down and inward. That's the normal response. But if the big toe extends up and the other toes fan out, that's called a positive Babinski sign. And in an adult, that is a major red flag for a disease of the central nervous system. But here's the crazy twist. That abnormal response, with the toe going up, it's perfectly normal in a baby under 2 years old. Why? Because their nervous system is still developing and insulating itself, so their toes go up. It's just a fantastic example of how the exam has to interpret clues based on a patient's stage of development. So cool. We are getting close to the end of our investigation. The detective has checked the command center, they've checked all the wiring. Now it's time to look for the final, critical clues that could point to some very serious conditions. If a doctor suspects something serious like meningitis, they check for irritation of the brain's protective lining. And beyond just a stiff neck, they look for 2 specific signs. With the Brzezinski sign, if the doctor lifts the patient's head, their knees and hips will automatically bend up. And with the Koenig sign, they can't straighten their leg out fully without pain. Both of these are physical clues that scream that something is wrong. Now, the neurological exam is an incredibly powerful tool, but sometimes the detective needs more evidence to crack the case. The findings from this hands-on exam are what guide all the next steps. They determine if a patient needs a CT scan, an MRI, or maybe even a lumbar puncture to confirm that final diagnosis. So from a simple knee-jerk to the complex language of consciousness, the neurological exam is really a journey into the body's most intricate and amazing system. It just shows how every thought, every sensation, every movement is all connected. So I'll leave you with this. Having seen a bit of how it all works together, what part of this incredible system do you find most fascinating?
Now let's check out the assessment of the 12 cranial nerves.
So, who exactly are these 12 operatives? It's time for a proper introduction.
Officially, they're called the cranial nerves. There are 12 pairs, and their job is basically to be messengers. Some carry sensory intel to the brain like, hey, you're seeing a bright light. Others carry motor commands from the brain like, okay, squint your eyes. And some, the real pros, do both jobs at once.
Let's start with the Intel division, the specialists who gather all the raw data from the world around you. This is how you perceive everything.
First up, cranial nerve number 1, the olfactory nerve. This is your smell expert. It's purely sensory, and it's the only reason you can savor that amazing aroma of morning coffee or fresh-baked cookies. You know, without this guy, life would be a lot less flavorful.
Next, let's talk about the one you're using this very moment. Cranial nerve number 2, the optic nerve. This is your vision specialist. It's a high-speed data cable running from your eyes straight to your brain, letting you see, well, everything. It's another purely sensory nerve, and it is working overtime for you right now.
And rounding out our main sensory crew is number 8, the acoustic nerve. Now this one's a bit of a 2-for-1 deal. It's not just in charge of your hearing, letting you process my voice, it's also your personal equilibrium system. It's what keeps you balanced and sitting upright. Yeah, pretty important, right?
Okay, so the intel has been gathered. Now it's time to do something about it. Let's meet the movement crew. These are the nerves that are all about action.
Your eyes don't just sit there. They move, they track, they focus. And for that, you need a team. Cranial nerves 3, 4, and 6 work together like a perfectly choreographed dance crew. The oculomotor nerve does most of the big moves. The trochlear lets you look down and in, and the abducens pulls your eyes to the side. They're a dream team.
Now here's a simple one you can try right now. Go ahead, just shrug your shoulders. That simple action, that's brought to you by cranial nerve number 11, the spinal accessory nerve. It also helps you turn your head from side to side. Pure motor, all action.
And finally, for our dedicated movers, we've got number 12, the hypoglossal nerve. This is the specialist that controls your tongue.
It's absolutely essential for speaking clearly and for swallowing. Without this nerve, having a conversation would be, well, really difficult.
So, we've met the intel gatherers and the action crew. Now it's time to meet the most complex agents of them all, the multitaskers, the nerves that do it all.
First up is a big one. Number 5, the trigeminal nerve. Think of this as the general manager of your face. On the motor side, it powers those super strong muscles you use for chewing. But then, it's also responsible for almost all the feeling in your face. The touch, the pain, the temperature, you name it.
Next, let's meet number 7, the facial nerve. Its motor function is all about expression. Every single smile, every frown, every surprised eyebrow raise, that's all thanks to this nerve. But it's got a sensory side gig too. It handles taste, sweet, salty, and sour on the front part of your tongue.
Nerves 9 and 10, the glossopharyngeal and vagus nerves, are the ultimate dynamic duo of the throat. They work so closely together that they're basically a package deal. Together, they manage the super complex act of swallowing, they control your gag reflex, and they even affect the quality of your voice. They keep you eating and talking safely. Okay, wow. That was a ton of information, right? 12 nerves. Some are sensory, some are motor, some are both. How in the world are you supposed to remember all of that? Well, turns out there's a cheat code.
For literally centuries, students have used a really clever trick to keep this all straight. It's a mnemonic device, and it's like a secret password for remembering nerve functions.
Here's how this amazing little hack works. You just have to remember a simple phrase. Each word in the phrase corresponds to a cranial nerve, 1 through 12, and the first letter of each word tells you its function. S for sensory, M for motor, or B for both. It's really that simple.
Let's say it one more time to really lock it in. Some say marry money, but my brother says bad business marries money. It's a little goofy, I know, but trust me, it's incredibly effective. That's the secret code to your brain's special ops team.
So now that you've been introduced to all 12 of these incredible specialists, from the one that lets you smell a flower to the team that lets you swallow your food, I've got a question for you. Which one of these nerves do you find the most amazing? And why? Let us know what you think.